So today we report 594 cases, 17 deaths, which has been our number for a few days now, 3 in the hospital, inpatient, 2 of those in ICU, 356 at home, 218 recovered, giving us a 2.8% case fatality rate based on the cases that we actually have confirmed. Monitoring, as you know, has to do with traveling or other exposures. So these people have been under quarantine and monitored by our staff. 642 of those are complete, and we are still actively monitoring 274 people. If we look at the percent breakdown of hospitalized compared to home, basically 99% of our people are at home now. We have a small number of people in the hospital when you look at just 3. And actually, if you break that down, hospitalized and ICU, and split those 3 down into 2 more numbers, you get 0%. So we probably should put less than 1 on that. So with 37% recovered, 3% fatality rate, and 60% at home. So our cumulative case graph looks like this. So basically you see, as we were hoping, that this is starting to flatten. So we have had a decrease in the number of new cases per day, fairly substantial in the last, say, 7 days. When you look at our incidence curve, it looks like this. So this is just the number of cases per day on the graph. A lot of times we report out a certain number of new cases per day, but eventually when we do an incident curve, those cases go back to the date of the onset of symptoms. If we don't have a date of onset of symptoms, it's a date of referral. In other words, the day that they were submitted into our system, probably referred to testing. So that is how we come up with a date for cases, which will vary a little bit from what you see in terms of new cases reported out by the media per day, because they go on a specific day eventually. So when we look at our percent positives per day, you can see that out of all of the tests that we've been doing in every given day, our percent positive on days has dropped. I think one of the things that I will show you next time is kind of where we have been with regard to testing and the number of tests that have been done in the county. Last I knew, it was 7,000 to 8,000, which is a lot compared to a lot of other counties, especially counties our size. We were ranking in the top 3 or 4 or 5 counties in the state in terms of number of tests that we have done in Ingham County. You put that incidence curve on in a rolling average, and you see, in a sense, we kind of had almost a double peak, it kind of looks like. So we had that peak that we saw in early April, late March, that kind of started dipping down on us, and then we went back up. But you can see that a lot of this right in here, except for these few days right in here, really have to do with increased testing. When you see that these numbers, these numbers were high relative to these, but this number is much lower. So more testing, more cases, lower percent overall, which means we are on that downward trend. So we need to be looking at both of those numbers. I show you this graph regionally, and so I didn't want to leave it out today. When we take those 7-day rolling averages and put it into Clinton, Eaton, and Ingham counties, it looks a little bit more like this. And again, the percent positives per day is in this line. And so even though these numbers came drastically down and then sort of came back up, this trend downward tells you really that more has to do with increased testing rather than increased transmission or increased numbers. I mean, clearly we're detecting more numbers, but what we're really concerned about is upticks in transmission. If we look at our daily hospitalization, it looks like this. So we have been sitting with 3 people in the hospital, 2 in ICU for several days now, but that number has just been gradually trending downward, sometimes in big jumps like here, and then just another gradual jump. So that's where we're holding. That is Ingham County residents only. If we look at our zip code prevalence, we still see 48911 way out ahead in this 171 to 180 range. and we go all the way down to 48911 at 71 to 80 to get our next highest range. And then we're in 48823, which is Lansing, 48864, which is Mason, and I think 48842 is Holt up in here. So this is what the map looks like when you look at just case counts. So this is numbers of cases, and the shading is based on numbers of cases. So that looks like that. And we have a mistake in our graph. So this Lansing shading right in here is 48910 and should be this very dark blue color here. So this is what I get when I only get charts and graphs 10 minutes before I go live. So that is an incorrectly shaded graph. This dark blue, just take this dark blue right here and paint it right in there. So sorry about that. We will get you a corrected map if you all want to see that, or you can go to our dashboard later today and you should see this map on our dashboard. If you look by rate, we have dropped out all of the zip codes that have fewer than 20 cases. I've had to explain to you over and over again that when we calculate rate, we really need at least 20 cases. And if we calculate a rate for places where there are less than 20 cases, there's not a lot of confidence in those numbers. So given that we have a number of zip codes that have more than 20 cases, what we did was started calculating rates just in those zip codes and leaving out this outlying area. So before, you would always see this Onondaga shaded really heavily, you know, very, very few cases there, but also very, very small population. So that really calculating a rate there is a very, very difficult thing to do. So we have dropped those off and are just focusing on the zip codes that we do have the correct number of cases to be calculating a rate with some sort of confidence. So our breakdown by sex is 51% female, 49% male. And then if you look at age groups, and what I'm going to do here for the rest of these cases, since we talked about 48911 last week, is we're going to go through the rest of these Ingham County and then 48911. So this is the ages, 8 cases by percent in these age groups. Again, what we see really is pretty much across the barrel, everywhere from 20 to 29 up to 50 to 59. So from 20 to 59, really an almost equal number of percents of cases in each of those age groups. So I would put those all as relatively close to the same. When you look at 48911, again, we see this, and sorry, my graphs look a little different. I do these, my epidemiologist did the others, and I can't make them look the same. I have to play around with it some to get these labels. So what you see here is that really what we're seeing is the 30 to 39 age group. And I'm sorry I should have put labels on there in terms of getting that percent, but it's approaching 35% of our cases there that are in the 30 to 39 age group in our 48911 zip code. So if we look at cases by race, by percent, 46% Caucasian, 27% African American, 17% Asian, and 3% other. If we look at that by race in 48911, we see, and I really apologize for not getting the data labels on this. Over 40% of our cases in 48911 are Asians. About 27% of our cases in 48911 are Black or African American, and then we drop down to about 16 or 17% that is our Caucasian population. Now, if we look at that by rate or prevalence, again, what that does is lift the population to 100,000 across the board. So if we had 100,000 Asians in the community, and we know that a certain percent of them have COVID-19, then we can calculate a rate in that population. We know that there's a small population of Asians in the community. You multiply that number up to 100,000, you take the number of cases and you extrapolate that out as if it were 100,000 as well. So the same multiplication factor. So for example, if we had 2,000 Asians in, and it's more than that, let's say 5,000, let's say 10,000 because it's easy math. If we had 10,000 Asians in Ingham County, we would multiply that number by 10 to get 100,000, right? So we would multiply the number of cases in Asians also by 10 to calculate that rate. So clearly we don't have that many here, but anyway, what we're seeing here now is even county-wide, the prevalence among Asians is higher than our prevalence among African Americans and our other population as well. And then Caucasians being the lowest. So we have a significant disparity between our other populations, first African Americans, and then even more of a disparity between our Caucasians and our Asian population. That's in the county as a whole. When you look at the prevalence rate in 48911, you see this, where the rate for Caucasians is 130, the rate for our Blacks is 450, and the rate for our Asians is 3,339. I believe there are about 2,000 Asians in 48911, and about 74 of the cases in 48911 are Asians. So we also started tracking confirmed cases by ethnicity. I've only got this county-wide. I don't have it in my 48911 zip code because we have a lot of missing data, and that gets even more problematic with smaller numbers. So we have a 8.7% of our cases are in our Hispanics or Latinos, 79.7% in the non-Hispanic Latinos, and then 11.6% of those are unknown. So if you look at that prevalence rate, we're at about 175.4 for our non-Hispanic or Latino population, and at 221.1 for our Hispanic or Latino population. Just a little bit of a breakdown on deaths. So far, our deaths have been by percent, 50 to 59, 11.8%, 60 to 69, 17.6%, 70 to 79 is our 41% of our deaths, and then 80 plus 29.4. We are 59% male and 41% female in deaths, and 41% African American and 59% Caucasian. And I believe that is the end for the day. So stop sharing, there we go. Those are the numbers that I have for today. I don't have anything specific outside of that to share with you. I thought I'd just turn over to questions again with probably just a couple of caveats. And that is that even in the Black population in 48911, of those cases, about 8 or 9 of those are also refugees. So if we start looking at refugees in 48911, both Asian and Black, we add some more population in there. We also have some outbreaks associated with facilities that are pretty much tied into the 48911 issue, and that's an outbreak at Herbrooks, which you know about, an outbreak at Meyer Warehouse as well, and then the long-term care facility outbreaks, which have been part of our reporting or the state's reporting, have, of course, don't fall into the 48911 group. So just a little idea that within 48911, the refugee population includes Asians and Blacks. So some of that Black population is also a refugee population, as well as the connection to the outbreaks that are going on. So there is where I stop.
Does anyone have any questions? Megan Banta. Go
ahead. Do you know how many cases are connected to the Meyer Warehouse outbreak?
Yeah, 46. So we have 46 cases in Ingham County tied to the Meyer Warehouse. There probably are more. That's an Eaton County facility. So again, from a facility perspective, that is in the jurisdiction of Eaton County. So we have 30 of our 46 cases that are employees, and the other 16 are household contacts to those employees. You just asked me about what Meyer Warehouse, right?
Yeah.
Okay.
Does anyone else have a question? No. Megan, you have another one?
Yeah, I mean, I guess just since that's two outbreaks now impacting the refugee community, how is outreach going? I know, with all the different languages, there's some barriers, but
Yeah, I mean, there are some barriers, and then we do have an incredible support system in our community that has been part of welcoming refugees into our community for a long time. So Refugee Development Center, others, St. Vincent's Catholic Charities, who's the designated refugee settlement agency. So they have a lot of staff and a lot of work that help us with that communication. So definitely breaking down some of those barriers and continuing to work for them. The communication really has been there through those resources since the beginning. So, we're looking at other things in addition to the language barriers. So those organizations are helping us. They're helping us with outreach. We're getting into the communities. We had staff in those neighborhoods this weekend, just door to door, talking about issues, talking about masks, those sorts of things, probably helping with supplies like that if necessary. As well as testing events. So we did have a testing event last week that was primarily focused on our refugee population and the refugee settlement organizations as well as the other support organizations helped us, outreach to them to get them in for that testing event. There will be another testing event this week that actually will be in that neighborhood. We had them come to Forest Community Health Center, which is in 48911. But not really as close to some of the apartment complexes and places where we know these folks are living. So we are going down into the neighborhood with some help from MSU Health Team to do some testing, I believe this coming Friday or over the weekend related to that as well. So more testing, more communication, more basically, investigations and assistance with just all of the things that need to happen to kind of contain the outbreak and help with understanding about social distancing, help with solving problems within households where that just isn't possible, things like that.
Rachel Sweet?
Hello.
Hi,
So,
Rachel.
how are ya?
I'm hanging in there.
Me too. A couple questions. Whitmer said today, the governor, in a Detroit station interview, that stadiums won't be filled this fall. Do you agree with this? Or what do you think?
What's that again?
That stadiums won't be filled this fall. That's what she was stating. What do you
I
think of it?
am going to have to guess that is entirely possible. I don't, those large gatherings, those large sports gatherings, concerts, some of those other kinds of events, large festivals, things like that. Those are going to be some of the last things that are going to basically open up. And it is really unclear at this point whether we will be there by the fall. So I would put it in the definitely doubtful category. I don't think it's impossible, but it seems pretty doubtful.
Okay. And then, some universities like CMU and Ferris are announcing plans to go back to face-to-face instruction.
Mm-hmm.
Do you think that MSU should be taking these types of steps to have classes back in the fall, face-to-face?
I think all universities need to be looking at both approaches, right? They need to be planning to be having students on campus in the fall, but they also need to be planning on how they might deliver distance learning for a period of time longer than that. Because I don't think we know yet what's really going to happen in the fall. And if I were them, I'd be ready for either one.
So what risks would they encounter if they decided to do face-to-face in the fall?
Well, I mean, they're going to have to, be concerned with distancing kinds of issues. They can, of course, control that to a large extent in their classrooms. There's all kinds of things they can probably do about classrooms and classroom sizes. But I think there are some that, make it relatively impossible. I can tell you, and I'm sure some of you experienced the same thing. When I took Biology 101 in college, I was in a giant auditorium with about 300 or 400 other people. And it's not like they can move that to an auditorium that, seats 1,000 people, especially when it's multiple classes like that and they don't have that. So when you have classes like that and don't have the ability to break them down into separate learning groups or smaller classrooms, and you have 300 or 400 that are in a large auditorium, then those are the kinds of classes that might have to stay online. And then you deal with smaller classrooms, perhaps in different ways. So they're going to have to accommodate, keeping size of classes down so that they don't crowd in classrooms for a while, those sorts of things. So if that's not practical for them to do, they may choose an online format, because there's a lot that goes into, putting fewer kids in a classroom and then having more sessions to have to teach because you have fewer in the classroom versus offering online options. But I am not running the university, nor am I an educator. So those are just guesses, and I would recommend that you talk to the university about that. But I do think they need to be ready for both.
Okay, thank you.
Yeah. I think crowding is probably our biggest concern. And like I said, they've got control over that in classrooms, but they don't when it goes to, activities and socializing and all that sort of stuff. So that those are going to be some hard choices and some hard things to figure out.